Good morning, everyone. Thank you so much for joining in to our Capital Blue Cross webinar. I think you're going to find the information that you hear today very informative and certainly something that's going to come in handy with the product knowledge for 2016 enrollment. As we all know, open enrollment starts November 1st and runs through January 31st. So all of these displaced folks have from November 1st to December 15th to make a choice for a 1/1 effective date and have seamless coverage. So that's those are very important times that you need to be mindful of. For those of you that are new to URL and new to this format, if you do have questions, we'll take those at the end, and you can ask those in one of two ways. You can type in your questions in the little question box down on your control panel on the right-hand side of your screen, or you can raise your hand, the little hand icon, and we can unmute you, and you can ask your question live. Also, I just want to bring to your attention, you're looking now at our new home page for our new website. Please go to our website, log in, and play around with it. Let us know what you think. There's a lot of good information on there. And this is going to be a source of information for all 2016 product information, and of course, what we have had the last couple of years under departments and health plan options and product information. There is a whole section devoted to FFM resources and links. Those are all hyperlinked right to healthcare.gov, and every single one of them has something informative in them, and definitely something that will prepare you for open enrollment. So without further ado, we're really excited to have this opportunity to share Capital Blue Cross's programs for 2016. Rates are not going to be discussed today, at least specific rates, because they're still with the PID. Hopefully soon will be released. But we're very, very pleased to have Jody Klymans with us. Jody, as you know, is the Director of Individual Sales and Producer Relations with Capital Blue Cross. For those of you that have attended our leaders conferences the last couple of years, Jody has been there as well doing the presentations. She's a great source of information and runs a tight ship. So she's valuable, invaluable, I should say, to me and to my staff, and will certainly, I think, come in very handy, her and her staff, as we move through 2016. So I'm going to hand over the controls to Jody right now, and she's going to get started with the presentation. So thank you, Jody. Jody?
Yes.
There you go.
Thank you. Let me get this in presentation mode here for you all. There we go. Let me first thank Deb and the URL team for having us here. It's a great opportunity. I am thrilled about 2016 and the opportunity that's being presented to us in part by what's happening in the market, but also through some strategic decisions that we have made here at Capital regarding our individual product portfolio and our pricing strategy. I think all of that combined will make a great year for us. I have Cecilia Kiesecker here with me as well, who is our producer coordinator, and she and I are here and ready to assist you with anything you need for 2016 as you start to potentially dive back into Capital, reacquaint yourself with our product portfolio, and look to get set up on our producer portal for access to any information that you may need. What we'll cover today, we'll talk a little bit about what's new and real high-level information on AEP versus SEP. This should be a refresher for most of you operating in the individual market. We'll talk about our 2016 medical products. We always review our networks as well as our ancillary product offerings. We'll talk about some changes to our pharmacy program, give you an update on where things stand with our renewal communications for our existing population, some sales strategy. In that section, we will tell you about our filed pricing adjustments but as Deb said, we do not have final approved pricing and any sense of where the competition's pricing is coming in for 2016. Once we have that, we will refine that sales strategy information and really hone in on areas where you should be able to sell a capital product. Hopefully that's everywhere, but we will take a look once we get finalized pricing and share that with you. We'll talk a little bit about some of our other resources on our broker portal. Very important to you all is our commission schedule, so we will certainly spend some time there and give you some miscellaneous updates. So off the bat, you're probably wondering what's changing for 2016. Real high level, and we will dive into all of these in more detail. As far as benefits and pricing, we will have some additional product offerings in our product portfolio. And you'll hear me stress this throughout the presentation. With everything happening in the market and many carriers pulling back their product offerings, discontinuing plans, pushing consumers back out into market, and eliminating product offerings, you will not see that happening with Capital. We have maintained a relatively consistent product portfolio from our 2015 plans, and we're adding in a couple additional offerings. We will have some more competitive pricing. We'll touch again on what Capital has done from a filing perspective, and depending upon where the market pricing comes in, that will give us an indication of just how competitive we will be and if we'll open up additional areas where you'll be able to really feel comfortable selling a Capital product. We are embedding our pediatric dental plan within our medical products, so everybody jump up and down and cheer at your desks. I know that has been a point of contention with our 2015 products, very confusing in the market, and we have for 2016 corrected that and embedded the pediatric dental into the medical programs. We are rolling out a Healthy Rewards member incentive, which we'll talk about, as well as our Advanced Choice Pharmacy Network. And if you operate in our group space, you know that they, in the small group portfolio, have added a telehealth benefit. We are adding that benefit as well for our PPO block of business. For processes, I'm excited to tell you, and we'll share a couple screenshots with you today, that we will have an online agent-assisted enrollment tool that will allow you to do the direct connection to the FFM, pull in subsidy information, and sell policies through an electronic tool that will recognize you and carry your NPN information through that process. We will have paper rate sheets available for you as well. We did get this request that everybody was looking for a rate guide similar to what some of the competitor plans do, so we will have a 2016 paper rate guide for you. And we've extended deadlines for our off-marketplace enrollment, which we'll cover. Renewals, I'm happy to say that we did make a conscious effort this year to ensure that anybody that had a 2015 policy had a home going into 2016. So the individuals that we have on the books today will either be renewed into their existing plan, they will be renewed with some benefit changes, or they'll be mapped to a similar plan. We are not discontinuing plans and pushing folks back into the market. If a plan is discontinued, they will be mapped to a plan similar to what they have today. Doesn't mean they have to keep it. They can always change plans, but they will have a home if they take no action. Real briefly, open enrollment, you all should know, runs November 1st through January 31st this year. And the deadlines that you see in front of you now are for on-marketplace enrollment. We are following the 15th of the month FFM cutoff dates. So December 15th would be the cutoff for a January 1st effective date, and following through January 15th for a February 1st effective date. Off-marketplace, we have decided to proactively communicate some extended deadlines because we do have flexibility when we're enrolling off-marketplace. Last year, we saw carriers going back and forth and at the very last minute making decisions to extend deadlines or take enrollment up until a later date because there were issues with enrollment or tools didn't work, or folks were just late in getting to the marketplace to pick a plan. So what we're doing for our off-marketplace enrollment is extending deadlines. The December 28th and January 25th that you see on the screen are the last Monday of the month. So we will take an enrollment application for a January 1st effective date off Marketplace up until December 28th. That gives you a little more time for those folks that no doubt will come to you on December 16th, 17th, 18th, Christmas Eve, and call you and say, hey, I just realized I need coverage January 1st. We will take those applications up until December 28th. For February, we will take applications up until January 25th, and then anything beyond January 25th would be for a March 1st effective date. I won't spend much time on this. You are all living this right now. Special enrollment periods. This is just a list of some of the qualifying events that trigger a special enrollment period. So let's dive into our 2016 individual medical products. I will skip this slide because it is really just a little bit more detail on our first What's New slide. This is very familiar to you all. It's our standard kind of product portfolio continuum that we show every year. We will continue to offer products in every metal level. So we will have our catastrophic HMO plan, and we'll have coverage all the way up to the platinum level with our Healthy Benefits 0.0.10 program. The next several slides will break down for you by metal level our existing 2015 plan on the left. We'll give you the status for 2016, so what's happening with that plan. If there are benefit changes, we'll include those. And then if the plan is being discontinued and mapped, we will share with you the products that they are being mapped into. For those of you that need a refresher on our naming convention, all of Capital's plans for the ACA products are Healthy Benefits programs. That is our marketing plan name. And you'll see in this example, it's a Healthy Benefits 0.0.10. That first 0 indicates the deductible. So this platinum option has no deductible. The second 0 is a coinsurance. And the last number, in this example of 10, is the PCP copay. So this plan is 0 deductible, 0 coinsurance, and a $10 PCP copay. You'll see here the benefit change listed for our platinum option. The maximum out-of-pocket is going from the $63.50 up to the 2016 limit of $68.50 for a single. That will be consistent across all of our products with the maximum out-of-pocket increase for 2016. This slide shows our gold options. We will continue to have our Healthy Benefits 500.0, so a $500 deductible with no coinsurance, as well as our $1,000 deductible plan with no coinsurance. We are discontinuing the Healthy Benefits 3,000 plan, but those members will be mapped into the Healthy Benefits 1,000 option. The next several slides show our silver product offerings. And the first thing I want to mention here, you see for our Healthy Benefits 0.0 program, you see a lot of small copay changes. And Capital is not alone in that the actuarial value calculator released from CMS this year changed from 2015. What that means is that as we key in our benefit information and the calculator spits out an actuarial value and tells you if your plan qualifies as a silver or a gold option, because they changed that actuarial value calculator, plans and benefits that qualified as a silver product for 2015 could have potentially fallen out of the allowable actuarial value range to be considered a silver option for 2016. In order to get those products to fit back into that acceptable actuarial value range with the new calculator, carriers had to make what looked like some funky kind of little nitpicky benefit changes. That's the reason behind some of those. So changing some copays up $5, down a couple dollars. You'll see that across carriers that have plans renewing. Again, it was to get those products to fit back into the metal level based off of a new actuarial value calculator. You'll see in yellow on this slide, we are adding a Healthy Benefits 1500.30 plan. This means that the product has a 30% coinsurance. This was added as a request from the market because we had gotten a lot of feedback last year that our plans were very rich. And many, many consumers like that. It has been one of our selling points, that we offer very comprehensive budgetable plans because there is little risk with coinsurance associated with our products. But there is that certain segment of consumers that were looking for a plan. They may have been under 30 and were looking at a catastrophic plan, but wanted a little more coverage than that bare bones type of cat plan. But they didn't want the premium associated with it. And the way to do that was obviously to add a higher coinsurance. So it makes it a little more responsibility from the member cost sharing perspective, but makes it a little more palatable as far as the premium. I know other carriers had programs in the market last year that had additional coinsurance options. So we got feedback from market that it would be great if Capital had a program or two with a higher coinsurance associated with it. So that is why we have now for 2016 a 1500.30 plan in our silver product offering. You'll see here most of these plans are staying in place for 2016 with some benefit changes. In yellow on this slide, you'll see a PPO HSA program. It's a $3,000 deductible with 10% coinsurance. Because it's an HSA compatible plan, we are offering it as a PPO only. Capital does not do or have a preferred financial institution for the HSA component, so a consumer would need to set up their own HSA that they can pair with this high deductible plan. This product was introduced because we have been seeing a lot more consumers that are coming out of group product offerings where they may have had a savings component associated with their program, and when they looked at Capital's product portfolio, we did not have an HSA option in place. So we've added that program offering really to accommodate those folks that are familiar with the savings account and may have an interest in setting up a savings component for their plan. We are continuing to offer our bronze product. It was previously a 5500.50 plan. For 2016, that deductible is changing to 6300. And we will continue to have our catastrophic program. This is an HMO only, and it's only available to individuals under age 30 unless there are hardship exemptions. Because the out-of-pocket went up to $6,850, this plan's deductible, which matched the out-of-pocket, increased as well to $6,850. I just want to refresh you all on our Care Connect program that you saw in our product portfolio. This is an accountable care arrangement. It is only offered off-marketplace as a PPO for members living in Cumberland, Dauphin, or Perry County. Because it's a partnership with Pinnacle Health, there is lower out-of-pocket costs for care that is coordinated through a Pinnacle Health provider. If you've got consumers and clients that are living in those counties, it is certainly worth the conversation. If they're using a Pinnacle Health primary care physician or a physician of choice for their services, they are most likely being referred within the Pinnacle Health system. This product can save them about 4% from a comparable PPO in our book of business. Because it's a PPO program, there is still an self-referred component to it. It does have a higher deductible if you choose to self-refer and go to a non-Pinnacle Health provider. And there is an out-of-network benefit because it is a PPO program. So I always consider it a three-tier type of a benefit program with a coordinated care cost sharing, a little bit more cost sharing if you're self-referring, and then the out-of-network benefit that would have the most cost sharing on the consumer. I want to spend a couple minutes on our network. We do offer HMO and PPO products, again for 2016, both on and off the marketplace. There are some exceptions, as you saw. The catastrophic program is only an HMO, and our Care Connect product is only a PPO program offered off marketplace. We always spend some time talking about the HMO versus the value HMO network. When you purchase a plan off marketplace with Capital, if you're purchasing a PPO program, whether you buy it on or off marketplace, you get the PPO network that everybody is familiar with. It is the standard PPO Capital Blue Cross network that has out-of-area coverage associated with it. If you are purchasing an HMO program off Marketplace, you'll be enrolled in the Keystone Health Plan Central broad HMO network. It is the Keystone network that everybody knows and loves. When you go to purchase an on-Marketplace HMO program, the distinction is really going to be driven by the county that you live in. So we have an HMO county service area that qualifies for our Value HMO program. The 8 counties that you see shaded on this map make up our Value HMO counties. If you are enrolling in an HMO program on Marketplace and live in one of those counties, you are automatically enrolled in the Value HMO. It's not a choice. It's not a choice for somebody living in one of the white counties to pick Value or non-Value HMO. The county of residence determines the network you get when you purchase an HMO plan on the Marketplace. If you're purchasing a Value HMO plan on the Marketplace in one of those shaded counties, you have to get all of your care within those counties. So you can't go outside if you're living in Cumberland County. You can't go see a provider in Adams County for your care. It all has to be coordinated within that Value HMO network. If you have a Value HMO plan and you're outside of those 8 counties, you do still have emergency and urgent care like you would under any HMO program. You do not, though, have the away from home care and Blue Card until you are outside of the full 21 county service area. The list of providers that are participating in the 8 county Value HMO network has not changed from 2015, nor has the list, obviously, of providers that are not participating in the 8 county Value HMO. I want to make sure you all understand this because we always ask that you consult with the consumers that are looking to purchase on Marketplace with an HMO product. They always have a PPO option available to them. It will really depend on the client that you're working with and their level of comfort with the providers participating in the Value HMO network. You all probably know that you have some clients that would not go anywhere but Lehigh Valley Hospital or Hershey Med Center. And if they're not in the network, they're not interested. You want to make sure you understand that and steer them towards the PPO product on Marketplace rather than putting them in a Value HMO only to find out a month later that they want to change their program. For those consumers that don't mind as much, they're relatively healthy, they don't have a preference for a certain facility, the Value HMO is a good fit for them, and it will be the lowest price point that they'll find on Marketplace. Our dental and vision products, the biggest thing that is new for us for 2016 is that we have embedded our pediatric dental in our products both on and off the Marketplace. We have also changed our HMO plan name to Select. And the reason for that is because the PID had come back to us and said there really is no health maintenance organization oversight from a regulatory perspective on a dental plan, only because you have to select a primary care dentist. As a result of that, we changed the name from HMO to Select because you have to, and I'm doing air quotes now, select a primary care dentist. So you'll see that in all of our marketing materials. The plan is the same, it is just a change to the name. And our vision product that's offered, there are no changes for 2016. As far as pricing on our dental plans, I'm pleased to tell you that our dental premiums are decreasing for our PPO dental plans, and our HMO dental products and our vision products, our rates are remaining flat. This is just a snapshot of the products that are offered both on and off the Marketplace. Our most popular plan is our Healthy Dental PPO Plan 1. We will still continue to offer a pediatric dental plan. The likelihood that you would need to sell that or have somebody coming to you interested in a standalone pediatric dental plan should be relatively minimal because Capital, as well as most other carriers, will now have embedded pediatric dental in the medical policy. slide just shows you the difference between the PPO and the Healthy Dental Select. So under the PPO program, you have the ability to use any licensed dentist, versus under the Healthy Dental Select, you'll coordinate your care through an in-network primary care dentist. The huge selling point with our dental plans, and you all are doing a fantastic job selling our dental programs, we always tout the fact that our plans have no waiting periods, with the exception of the medically necessary pediatric ortho. If you look through any of the competitor information on their dental programs, you'll see laundry lists of waiting periods for different services. That is not the case on Capital's dental plans, and it's a huge selling feature for us. The vision plan, as I stated, has not changed. It's a vision exam once every 12 months with a $10 copay. You have the freedom to choose any licensed vision provider. You're going to save with a network provider. Most of the retailers, huge retailers, are participating in the network: Walmart, Pearl Visions, Target, JCPenney's, and Sears. There is a fixed discount amount on lens options and a mail order contact lens discount program, so there is an opportunity to have contact lenses shipped right to your house. I know they ship that first order free of charge. So if you have consumers that need a program like that, please reach out, let us know. We can get you some marketing materials on that. And of course, there's discounts on LASIK surgery included as well. I want to spend a couple minutes talking about our pharmacy program just to refresh you. We are adding for 2016 the Advanced Choice Pharmacy Network. The biggest impact to this is the fact that Rite Aid and Walgreens are not participating pharmacies in the Advanced Choice Pharmacy Network. Anybody that's existing on our books today that has a prescription at one of these pharmacies will get a letter at the beginning of December to give them 30 days notice that Rite Aid and Walgreens are not participating within the Advanced Choice Network for 2016. The impact isn't huge, and that's because of some additional programs that we offer that I'll touch on. We have mandatory mail order and maintenance choice programs. They're continuing for 2015, and what those two programs mean is that after an initial fill and one refill at any network pharmacy, those prescriptions are automatically pushed over to Caremark for mail order. So members will get a letter from us and from Caremark indicating that they've filled their allotted prescriptions at a participating pharmacy. Now they need to move their prescription to mail order. It is a benefit for them. It's a lower cost share, and it's savings for us as a plan. They get a 90-day supply filled through the mail order at a lower cost. The Maintenance Choice Program simply says that if you're really opposed to mail order, you don't want to go through Caremark, you'd rather go pick it up at a retail location, you can pick up your 90-day supply at a brick-and-mortar CVS location, and you'll still pay the same as you would pay had you filled it through the mail order. Because of these two programs, there aren't a lot of members that are sitting out there today with Capital that have scripts at a Rite Aid or a Walgreens. It's those folks that may have their first fill sitting somewhere, or I have heard that out in the valley, the Walgreens is strategically located across from some of the hospitals. So somebody that may be leaving an urgent care center with a prescription, those are the consumers that you want to make sure understand that the Walgreens and the Rite Aids are not participating. We will continue to have a mandatory generic substitution program. This is simply the provision that says that if there is a generic available and you choose a brand name drug, you'll pay the difference in cost between the generic and the brand, even if the provider indicates that the brand is medically necessary. We do operate the individual products on a selectively closed formulary. What this means is that most brand non-preferred drugs are not covered, with the exception of certain limited classifications of medications. Multi-source brand drugs are typically excluded from coverage, and most brand non-preferreds are excluded. With that said, there is always a non-formulary consideration process. So if somebody is enrolling in an individual product and they've taken 5 different medications and they have an allergic reaction to a dye in one doesn't sit well and another one doesn't work, and they've been through the entire spectrum of medications, their provider can always submit a non-formulary consideration request and begin that process to have coverage for a non-formulary medication. I can't tell you that they will all be approved, but there is a process there for somebody that just can't take a medication that's covered on the formulary. Renewal communications, we did send out around September 16th our Personal Blue renewal notices. You all should have received a listing of your members that would have received a renewal, as well as any premium adjustments associated with it. Those folks in our Personal Blue medically underwritten plans can continue their program through 2016. The only adjustment to the pricing was an age band increase because everybody unfortunately gets a year older. We did not file an additional increase on that medically underwritten block of business. We did not, on October 1st, send out discontinuation notices, which is good news, because if you think about it, we really would have had nowhere to put those folks because we can't enroll and take applications until November 1st. Our discontinuation notices are actually scheduled to go out next week at some point, and you'll receive communication in advance of that with information on folks whose plans are being discontinued, as well as samples of the materials that they will get. Again, anybody getting a discontinuation notice will also have a program that they are being mapped to, and that will be communicated within that documentation. And on November 1st, we will be issuing the remainder of our renewal notices. So for plans that are continuing or continuing with benefit changes, those letters will be mailed out on November 1st, and you all as agents will receive a listing of those members that are getting that notice as well. Our dental and vision renewals, important to note because we have changed our strategy and have now included the embedded pediatric dental in our program. We had a lot of folks that purchased a standalone pediatric dental plan, and that is because you had to have a piece of paper, should Big Brother come knocking, that you could say, yes, I have pediatric dental coverage. Didn't matter if you were under 19 and qualified for benefits, or if you were 50 and didn't qualify for benefits, you still had to say that you had pediatric dental coverage. So if you sold a policy, you know we had all sorts of attestation forms, ways for folks to tell us if they had a plan, and if they didn't, we had a standalone plan that we would sell to you. However, if you were not benefit age eligible, there was no premium associated with it, and you got an ID card that you really couldn't use. But you had the piece of paper that said you had coverage. Because we're embedding the plans for 2016, anybody that was not benefit eligible age, so anybody over the age of 19, we will automatically terminate that standalone policy. They don't need it. They never paid a premium for it. We're going to clean up the system, cancel those policies, because we know that they have a medical plan with us, and the pediatric dental will be embedded. If they had somebody that was under the age of 19, we will have to renew those policies. And we have to renew them because we can't make the determination as a carrier that somebody should cancel a policy if they actually are benefit eligible. So I would encourage you to consult with those members. If they're going to renew into a capital medical policy, they probably can cancel that pediatric dental plan. We, as a carrier, however, cannot do that proactively on their behalf. For our standalone family plans, all of those contracts will be renewed. But again, if somebody has a pediatric dental plan or a PED covered in one of those family dental plans, they don't necessarily need to continue that. So it's a consultation that you'll have to have with them and an understanding of who's enrolled in what plans, so you can advise them what they can and what they should and shouldn't terminate. And we're here to help you through that process if you need any guidance as well. Many of you also probably have a link through Dominion that will get you to a website where you can sell the same products, and you can also sell a discount dental plan. That link will still work in 2016, so if you're using that and that's your preferred method to sell the dental and vision products, you can continue to do that. My only caution would be that the longer-term strategy is to eliminate that distribution channel and pull all of that enrollment back into Capital so it's consistent with the rest of our enrollment and sits in the same enrollment system with our medical and any of the dental and vision plans that are sold through our process. So the more folks that we put into the Dominion process is just that many more members that we'll need to pull out and migrate. You can continue to do it. We will have a process when that time comes, potentially next year, to move those folks back. But I wanted to just let you know that that link will still work, but I would recommend that you sell what you can sell through the Capital channel. Again, it's the same benefits, same pricing. A little bit quickly on sales strategy. You all know this. I've been preaching it for a couple years, but more so for 2016, plan, choice, and flexibility. We have about 15 products available in our ACA product portfolio compared to 3, 4, 8, I think maybe, that I've seen from the competition. Your clients should be able to find a plan at Capital that meets their needs financially and from a healthcare needs perspective. There are a lot of options out there, and there should be a product available for everyone. If we get folks that talk about pricing, we always like to just remind them that Capital, for the past 3 years, has taken a very responsible pricing strategy. So you'll see, and when we talk about our rates, we're able to come to market with minimal increases or pricing adjustments that are favorable from year to year. We're not making any drastic swings in our pricing and don't anticipate doing that in future years. And while we did add some plans with additional coinsurance to target certain consumers, we do still have our plans with zero coinsurance, so they're very budgetable and there's far less cost sharing than plans offered through the competition. When we talk about our dental and vision plans, we talk about the fact that they are the only Blue-branded dental and vision products offered in the region. Again, our PPO rates for 2016 will be decreasing. They were already very competitive. If you operate in a small group space, you know that we had a multi-coverage credit that was offered for a couple years. I was trying to get that on our individual product portfolio, and we agreed that instead of doing something like that, we would just take a look at the PPO pricing, and we were able to make some favorable adjustments to that across the board. And we talked about the waiting periods and no hidden fees. So for you as an agent, why do you want to sell Capital? Why are you participating and listening to me this morning? Because we have an attractive commission schedule. We have made and will continue to make timely commission payments. We always point you back through URL for any resources or quoting information that you need. But if you've sat in our presentations in the past, you know that Cecilia and I always include our contact information and make ourselves available to you as well. If there's anything that you need to reach out to us directly about, you can do that, and we will be here to answer your questions. A refresher on our individual rating regions. We do operate in rating regions 6, 7, and 9 that you can see here. And we have also outlined our value HMO narrow network counties in red. These are our filed rate increases. We did file small increases on our catastrophic and our platinum plans, 5% and 10% respectively. And we did that because those programs were very competitively priced in 2015 and will continue to be probably market leaders in the catastrophic pricing for 2016 and very competitive in platinum. By doing that, we were able to come to market with some pricing decreases in our middle metal levels. So the bronze, silver, and gold, we filed price decreases. The reason for that is we are trying to get a little more competitive in those metal levels where there are a lot of consumers that are eligible for subsidies that are purchasing on Marketplace to take advantage of subsidies and cost share reductions. So where to focus in 2016? I do this every year. I was hoping that by today I would be able to update this. However, without final pricing information and being able to dig into what's going on in the market, we had to go based off of our assumptions. So way back in April when we filed our products, we knew where we were going to file our premiums, and we made an assumption that our competitors would get a 15% increase. Based off of that, we anticipate that our catastrophic plan will still be the lowest price in the region, anywhere from 3 to 45% lower than the competitor's lowest price plan. Our Platinum plan, if you'll remember from 2015, was only competitive in certain regions. We would anticipate with the pricing adjustments and our assumptions that we will be competitive in all regions on our Platinum plan. And by competitive, we are indicating within 8% of most of the competition. Our Gold, Silver, and Bronze plans are narrow network value HMO, so somebody purchasing on Marketplace will be competitive. Off Marketplace, we expect to be competitive really in regions 7 and 9 in those metal levels. So much of this is going to depend on approved rate increases from the competition. So as soon as we know that, I will revise this and push it back out to you all through Deb and her team. We always encourage you to talk about the Care Connect plan in Cumberland, Dauphin, and Perry counties off Marketplace. And our most competitive counties, if you remember from last year, we had, I think, maybe 3 or 4 counties up here. Those counties will continue to be and will get even more competitive. Berks, Lehigh, Northampton, Lancaster. We are finding areas in Cumberland, York, Lebanon, Dauphin County where we will be competitive as well. And we just picked out the counties where we anticipate, based off of the pricing that we've looked at, where we will be most competitive. If you start to talk to somebody about the benefits that they get from Capital after they enroll with us, everybody will get a personal member page at mycapbluecross.com. They can access all sorts of information through our Search and Save Center, our health and wellness tools, and we have a mobile app. New for 2016, we are offering a Healthy Rewards program. This is a great selling feature. Anybody that goes online, once they have their ID number and set up their account at mycapbluecross.com, they can earn up to $50 for completion of an online health coaching program and $25 for a health risk assessment. So they can earn $50 in gift cards. They come automatically. There is nothing that you need to do or that they need to do to receive those gift cards. Everything is tracked from the online system, and once we go in and pull records and find out that they've completed one or both of those, we will issue a gift card automatically. Great selling feature. We did recently open a new retail location at the Hampton Marketplace in Enola. If you're local in the Harrisburg area and haven't had a chance to go out and visit it, I would encourage you to do so. Folks out in the Valley have really taken advantage of the retail location at the Promenade Shops at Saucon Valley. Great resources to you and to your clients. If you as an agent need meeting space to meet with clients, you can reach out to myself or Cecilia or to the retail stores directly, and we can reserve that for you. And for your clients, once they enroll with Capital Blue Cross, if they have their Blue Cross ID card, they can walk into either one of those retail locations for free biometric screenings. Lots of other services available there as well. Take advantage of them. Our broker portal, why use it? Well, you can access our product information. Everything that we talk about today will be available within the next week or so. I don't really have much more time than that, a week or so, to get this out there for you. The slide deck that we are reviewing today is already posted to the producer portal. You can access that. You will start to see information slowly added out there. Our marketing materials will be posted out there. SBCs will be added out there, as well as links to our 2016 applications and our quick quote tool that will continue for 2016. You should have received a BRK or an IND number at the time you were appointed with Capital. That's what you need when you get to capbluecross.com to log into the producer portal. With that letter giving you your BRK or your IND number, you would have received a temporary password. If you no longer have that, and if you have not logged in and reset your password, you can reach out to Cecilia and she can help you get a temporary password to log in for the first time. I would ask that if you are going to start browsing the Capital products, that you try and do this prior to November 1st so we can make sure that you're set up and have access. So come November 1st, you are in and active in the system. Once you're logged in, you'll see the different headings across the top of our web page, About Us, Individual Family Products, Members, etc., and you'll see a Producer tab. You'll want to click on the Producer tab and then click on Producer Tools. This screenshot that you see here is of our current 2015 materials that you see. We will still have our 2016 information linked directly under Producer Tools. So you will see our 2016 Quick Quote tool will be available, as well as a link to our 2016 Off-Marketplace application. And you'll also see an additional link sitting out on the producer portal that will take you to the direct enrollment tool. When we have finalized training for you, we will let you know when and how to use what application. There will be a couple instances where you will still need to use our what we call our freestanding web app, or this 2016 Off-Marketplace application. For the most part, though, you'll be selling and enrolling through a direct enrollment tool. The benefit of that to you is you'll get access to kind of a dashboard, so you can see who you've submitted applications for. You can search on those applications. It will automatically save PDF copies of those apps for you within the tool. The benefit to us and to your client is that the enrollment will come across to us as an electronic 834 file, so there is no manual keying of applications. That means that an ID card will be issued much faster than they were for 2015. We will still maintain Quick Quote. We talked about where that will be. Our subsidy calculator, we will still include that. We are still trying to get that built in potentially into our direct enrollment tool. So while you're shopping and looking at plans with a client, you could click into the subsidy calculator from there. If not, it will still be linked at our ChooseCapitalBlue.com site, which is really our direct-to-consumer individual site. But it does have a lot of good resources out there for you if you want to take a look and play around. What you see below is just a high-level screenshot of the online agent-assisted shopping portal. This is the dashboard that you would see for any clients that you are submitting. You can see if they are in progress, and you can pick up where you left off with that application. Or if it was completed, your submission, you can see that and view the PDF. I'm going to finish out this slide deck and then take you over to another one real briefly to show you, get you a little bit of a flavor for what that online enrollment tool has to offer for you. So commissions, our 2016 medical commissions have not changed from 2015. So for all of our programs except our catastrophic plan, we're paying $21 per member per month. It's capped at 5 members per family and level for the life of the policy. Huge, huge benefit and competitive advantage for us in the market. For our catastrophic plans, simply because the premium's lower, the commission is lower at $6 per member per month. Our 2016 dental and vision commissions aren't changing. They are a % of premium based off of the product that you sell. Marketing materials and rate tables are forthcoming for you. We will have and push out to you in a couple different forums and, I guess, ways for you to consume it, training on our open enrollment tool. We will give you some screenshots and some demos. I hope to do some real quick webinars for you at the time that it's available and a couple weeks into the beginning of AEP. So you can hop on a real quick call and walk you through the online enrollment tool. It's really intuitive once I flip over and show you some of the screens. I don't think you'll have any problems understanding it, and the value I think you'll see is just huge for tracking any 2016 enrollment. And just a reminder, if you have not completed your 2016 FFM certification, so please go out and do so. We do need copies of updated 2016 FFM certifications if you are looking to sell on exchange policies. My contact information and Cecilia's contact information is included here for you as well, and this slide deck will be saved or is already saved out to the producer portal. And I just want to let you know that at the end of the slide deck, if you have questions on how our billing process works, we had outlined for you, we call a normal enrollment, something that comes in from the 1st to the 15th of the month, and you can see the billing cycles here. For 2016, for folks that enroll at the end of the month, they will have a little bit more time to pay that first month's premium due to some changes through CMS that are allowing some additional time to pay that first month of premium. And we're also giving you some sample ID cards. Let me flip out here and take you over to some real high-level screenshots. I just want to make it very clear that the content on these is not 100% accurate. We are finalizing that now, but I wanted to give you a sense of what you'll see. You will get to this page, again, from the producer portal. So you will log into the producer portal, as we explained in the prior deck, and you'll have a link that will take you to Sales Connect, and that is our online shopping tool for agents. When you click over to Sales Connect, the biggest benefit that you get, first of all, is you don't have to sign in again. It's a single sign-on through our producer portal. It will recognize you. You will see your agent name on the screen, as well as your NPN number and your agency. We will have some links up here. Right now, they link you to Cap Blue Cross and Find a Doctor. We will have a button up here that takes you back to the producer portal. And you'll see options across the top to create proposals, a My Prospects dashboard, and you can go to the marketplace for subsidy information. You'll click on Create Proposal to start an application and to start shopping. And this is where you're going to enter in all that basic information. We will still have the Quick Quote tool available, so you're going to have to figure out what works best for you. I personally would encourage you to go through the direct enrollment tool to quote, because you can pull up the plans, line them up in a side-by-side comparison, and then you've already got some of the information saved out here should you need to come back and make any adjustments. The Quick Quote tool is really just a down and dirty, see everything, real high level. It doesn't have any tracking associated with it. It's a real kind of off-the-cuff quoting tool. Once you enter everything in here, you'll see down below, this is the same stuff that you'd be entering in the Quick Quote tool. You'll enter in the applicant details. Once you have all of that, you'll save and continue, and you'll get to a screen that looks like this where you can select plans that you want to add. You can select both health and qualified dental plans, and those products will show up when you click to the next screen, or you can click Marketplace and you'll get on exchange products. When you're ready then and you hit Actions, you can add plans, compare plans, and look at premium breakdowns. When you add plans, and this is very similar to online shopping, this kind of format should look familiar to you. You can get in and customize once you see pricing. I know most agents find one or two plans that they sell and sell well. They find them positioned competitively. When you get to that information, you can make those plans favorites, and they'll continue to come up when you get to your first screen, and you won't need to search on all of the products that are out there. You can select plans from these screens. You can filter plans if you're only interested in looking at certain monthly premiums, deductibles, metal levels. And if you want to compare plans, you just click in the box and you'll hit the Compare Plans button, and it will line them up side by side. When you update your proposal and you select the plans where you see the radio buttons on the left, those premiums will go over to the right and give you a total premium for any of the plans that you put together. So if you pick a medical plan and a dental plan, your total premium would show off to the right. The application process will look very similar to the online web app that we have today. So you're going through that basic information. When you've created the member information up front, it will pull all of that into the application so you aren't re-entering or dual entering member information. I'll skim through these because they're all demographic information. If you've selected an HMO product, you will have to choose a primary care physician. And then the signature options. If you are working with somebody over the phone, and I know it sounds very counterintuitive, but you would select online for a voice signature. There is the opportunity, which is we call telephonic, which really means that you're going to push the application out to that consumer for them to key in their own date of birth and for them to sign on their own. You have that option. There is a web conferencing feature available. I know some of you have asked about this. There is not a screen sharing component built into the tool, but I know many of you have your own screen sharing systems that you use. If you use screen sharing, you can click on web conferencing and you can log the date and time of your session that you did that screen sharing and submit the application that way. So a lot of options for you really now in 2016 to assist the consumer with the online enrollment. This is your agent agreement. Your NPN number will follow you the entire way through this process. And then signature information. Our consumer acknowledgments and agreements will be included in here as well. For 2016, for day one, we will most likely just be mailing an invoice to consumers. So you'll get to a screen that says, thank you for assisting and enrolling somebody in a Capital Blue Cross product. We will issue their first month's premium. We will give you options and links to potentially email out to somebody if they are interested in doing a bank draft or setting up a check it out program. You'll get a confirmation page. You can print or view the application. It's available in a PDF form for you. And some other things that you can do within the tool. Again, here's where you'll see your dashboard. You can search for consumers, applications that you've submitted. Tools and resources. The direct enrollment tool will not support our vision application for 2016 day one. So if you are enrolling somebody in a medical, dental, and vision plan, you can do the medical and the dental through this online portal, and then you'll need to link out to our standalone web application and complete that for the vision component. We will marry them up on the back end here to make sure that they get linked together and that they only get one ID number, and that vision plan is put with the medical or the dental option. Much more information on the direct enrollment tool is coming. At the time that we have our materials completely finalized and the screenshots are accurate as to what you will see, we will expand this training deck, push that out to you all, and like I said, we'll do some webinars for you to hop on and follow along should you want a refresher on it. The big benefit, again, you'll be able to track your enrollments and the link into the marketplace. I will have some marketplace screens when we do our official launch of the tool that will show you how you go out, get to the marketplace, pull in that subsidy information, and complete the application. I will go ahead and turn it back over to Deb, and if there are any questions, we will do some question and answer. I know I've gone exactly to 11 o'clock.
Well, thank you, Jody. That's great information, and surprise, surprise, we have a lot of questions. First was about commissions, and Jody went over that. That's $21 per member per month, capped at 5 per app. And Tom says, oh, well, Tom made a joke, and he said, and we'll actually get paid for 2016 SEP enrollment. That was just a joke. But yeah, that's true. Dave says, with a low deductible plan such as the PPO 0.0.10, isn't it virtually impossible to get anywhere near the $68.50 out-of-pocket max?
Yes.
So yes, it's difficult, Dave, but they did it. They managed to do it. Tom has a question. Any recommendations for a bank? And Tom, I always say, you know, most banks do HSAs now. So if your client has a qualified high deductible health plan, I always say check with your bank first. But there are standalone options out there through Health Equity and various vendors. So if you have any questions specific to that, again, just have them go to their bank, but you can just circle back around with me and I can give you some other options. Another question from Tom, is the PPO HSA 3000.10 a family 6000.10? And that brings up a good point. Are you doing the embedded HSA deductibles this year? And can you just address Tom's question?
The embedded HSA deductible. So similar to the group plans?
Yes.
Where the family deductible is 2 times the single deductible. But if I am a single member, no, I need to think this through as I say it. If I am a single member and I meet my $3,000 deductible, will my services be covered? Is that the question?
That's the question.
I believe the answer to that is yes. But I will certainly follow up and get specifics on that for you.
Okay, well, we'll circle back around on that one, Tom. And Scott, these products are only available in the 21 county central PA area, and we're looking at this as an outlet to, you know, the plans that were in place for the last 2 years. So this is you know, a welcome change. Tom says, can you explain the multi-source brand drugs?
A multi-source brand drug typically means that there's a generic available. So multi-source, if there's a generic and a brand, most likely you will not see the brand medication listed on the formulary.
Okay, thank you. And we will have the slides. We're going to pull that off the agent, the producer portal, and get that out in a newsletter or included in our newsletter. This is being recorded, so you will all get a link of the recording as well. And Jay said, were there still a couple of grandfathered plans or grandmothered plans still open until 2017? And I believe the answer is yes to that, correct, Jody?
Yes, that was our grandmother plans, was our medically underwritten personal blue plans. Those were the folks that got notification at the beginning of October, or I guess I should say the middle of September. Those folks can continue in that medically underwritten grandmothered personal blue plan through 2017.
Right. Okay. Perfect. And Kim's asking a question, when a plan renews and there is a plan change, will the writing agent automatically be the agent on the new plan, whether it was mapped or chosen by the client?
When the plan renews, so if you wrote the policy in 2015 and the plan automatically renews, yes, nothing changes in that agent assignment.
Okay, and let me just ask a little bit in a different way too. If there is a plan in 14 under Agent Joe Smith and Agent Tom Jones, they contact Agent Tom Jones and then they rewrite for 16, does Tom Jones then take over the case?
Yes.
Okay. All right. That makes perfect sense. There's a question about the cost sharing reductions, Tom, and I can circle back around with you on that. Is there also a process for doing a BOR if a client accidentally enrolls directly when they want the agent to get credit? Is there a BOR or a form to just you know, claim that case?
Yes, there will be. For 2016, we will have an agent of record authorization form. So we did get that request from a lot of agents that were familiar with them from other plans. So right. Within a week or so, when we roll out our information, you will see a capital form similar to what you've seen from other carriers that allow you to just indicate that you've assisted that consumer and sent that in. If there is another agent assigned to that, we will not make the change. But if it's a consumer that came direct or there is no NPN associated with that, we will go ahead and update that record with your agent information.
Okay, that makes perfect sense. And just to reiterate, the commission is $21 per member per month. That is the full agent commission, and again, capped at 5 per app. That is not to be split between URL and the agent. That is the entire agent portion. And Dave says, what's the deadline for sending you the 16 FFM certifications? What's your deadline?
Yeah, we typically obviously would like to have it before November 1st. We will circle back, though, if at the point in time that you try to submit an on-marketplace enrollment, if we do not have that FFM certification, we cannot pay you for that sale. So there is kind of a stopgap in place if you don't send it in to us, that we'll circle back with you to get that before we process that application. So I would encourage you to do it prior to November 1st so we have it on file and nothing gets hung up in the system.
Yeah, and October 26th seems to be the date that other carriers have chosen as the deadline for getting those certs in. Capital is very easy to get those certs. It's just simply an email address, and that email is, I can get that for you in a second, is cbcproducerlicensing@capbluecross.com. Again, that's cbcproducerlicensing@capbluecross.com. That's where your certs go. Okay, so Julie has a question. She says she's using an online broker that links into healthcare.gov for applications. If I sell CapBlue plan that way, how would I add an adult dental plan to that sale? Would I need to separately log into Capital's website and re-enter the app? No, and you can maybe answer this, Jody, but they're gonna, it really is redirecting you to healthcare.gov. So every plan that's available on healthcare.gov, if you just simply log into healthcare.gov, is going to be looked at when you go through BlueCross as well, correct, Jody?
Yes.
So you'll have access to the dental. You'll have access to the other plans if you choose, at the bare minimum, at least for comparison. Oh, we have a few more here, Jody. Are you okay with time?
I'm okay, yes.
Okay. Okay, so Margie says she's having problems with the voice approval of enrollment. Can't she just do an online application and sign online for the applicant?
With the voice approval online.
Yeah.
So I think I probably need to understand what problems that she's been having to better answer that. There are going to be a couple different ways that you can get that authorization from that member to complete that enrollment, and one of those includes sending that application directly to the consumer for them to do their own signature and complete that process. So hopefully in we have resolutions to that for you.
Yeah. All right, and that's fine. And Margie, we'll circle back around. I think that, you know, once the systems are up and running, we're going to be better able to tell, you know, a good practice for you as well. Donna says, is there a fitness center benefit offered or available for purchase?
There is a, through the Blue 365 program, when you have a Blue Plan card, you can enroll in a fitness center program that allows you to have access to a bunch of different fitness facilities at a low monthly cost. I can certainly pass you information, Deb, that you can send out to your agents on that plan. It's a great benefit of having a Blue plan.
Yeah, absolutely. Okay, perfect. George asks the question if we still handle paper applications and can they be sent to URL for processing, and absolutely. If we get a paper application in, we will convert that to electronic format on your behalf. And will ID cards be held until the first payment is received?
No, we will issue an ID card once that member is enrolled.
Wonderful. And Jay says, do we have access to the FFM Direct Pathway program now or not yet? And no, we don't have it now, but for 2016 we will. with Capital Blue Cross. And
Correct.
Dave says, can we see the status of short-term apps on our dashboard?
No, the short-term products are not through that Sales Connect tool. It's only the ACA programs.
Okay. And the website to look up doctors is capbluecross.com. There's a doc search, middle right-hand side. You can look for providers and hospitals. Jim says, is there a max family size for the premium amount? In other words, how many children under 21 do you count?
3.
3. Okay, there you go. 4th, 5th, and 6th, and 10th are free, Jim. So go ahead and fruits will multiply. Yeah. Are the personal Blue Saver plans grandfathered for 16?
Yes.
Okay. And Tom says, thanks for all the answers, Jody. And John says,
I want to talk to you. I think you're going to sell a lot for us.
Yeah, right, exactly. Did you say that the HMO value off FFM network is different from the HMO value on FFM network?
So off marketplace, there is not a value HMO network. The off marketplace HMO network is the same across all 21 counties, and it's the broad network. The value HMO network is only on marketplace within those 8 counties that were shaded in blue.
Okay. And Dudley asks, and this may be Medicare, can you explain the difference between the expanded performance formulary and the generic standard formulary, or does that only come into play in Medicare?
That sounds like a Medicare question, but I can certainly get the right folks to get back to you.
All right, Dudley. It didn't sound familiar to me either, but, you know. And Dave says, thank you. That was an excellent presentation. I would agree. And there's a few people asking for the email address, and I will email that to you. And that's it. Those are all the questions, Jody.
Great. So, well, I appreciate everybody hanging on with us for another 15 minutes.
I do as well. And thank you so much for your time, Jody. You know, prior to this whole PPACA law, Capital Blue Cross was our top carrier partner and did a wonderful job. The resources that they bring to the table, both in their knowledge and their willingness to answer questions in a timely fashion, really will make our lives so much easier. So, you know, this upheaval in the market and disruption in the market from the carrier of choice the last 2 years, please treat it as an opportunity, even though it's going to be nuts. Treat it as an opportunity and recognize it for what it is. You're not going to do your clients a disservice by moving them to a Cap Blue Cross plan, both in network, products, and certainly, you know, carrier reputation. So just keep that in mind. Keep the questions coming. If you have any additional questions, please give us a call, and we will supply all that information as soon as we have it available, rates, etc. So for now, again, thank you, Jody and Cecilia, and we will close this out, and enjoy your day, everyone.
Thanks, Deb. Thank you, Deb.